Recommends the malaria vaccine for children in Africa. Some doctors call this a historic moment and a breakthrough for science as the disease kills more than 260,000 children under 5 each year. Dr. Reena Mehta with Uptown Allergy and Asthma joins us now to explain. Good morning. How are you?
Good morning. I'm great. How about yourself?
Good, thanks. All right, so this is interesting. Obviously, this vaccine breakthrough is huge, and it's approved now for children. Tell me a little bit about the vaccine and kind of what it's going to mean.
So as you mentioned before, this is historic. This is the first approved malaria vaccine for children, and malaria kills almost about 400,000 children a year, and so this is a big deal. And so this vaccine is called Mosquirix, and it's approved for children starting at age 5 months. So it's a series of 4 doses where you started at 5 months of age, and what it has shown is that it has prevented severe death from malaria by 30%. So while it's not perfect, it's preventing death, and those severe cases of malaria we're actually having good outcomes from.
Now, when we talk about malaria and especially deaths in children, I mean, that isn't necessarily something that we experience here. I mean, this is something that's happening widespread in Africa, correct?
Correct. So, I mean, we are a developed country, so we only see about 2,000 cases of malaria a year. Usually those are from people who have traveled to the United States. So while this may not impact, our community, what it is showing is that as a world, we are really making strides in preventing, death in children who in those areas that have moderate to high risk transmission of malaria. And so, up until now, it's been, using these insecticide treated bed nets and, using medications once a child gets sick to treat malaria. So this is the biggest prevention technique that we've found through this vaccine. And what they found is if you do the vaccine, the Mosquirix, plus the bed net, it actually improves outcomes in children by more than 90% in those areas where there's moderate to high risk transmission in Africa.
Wow, and what an incredible, breakthrough that would really be to be able to save hundreds of thousands of children a year using a vaccine and the nets that are already there.
Exactly. And so, this is a historic moment, as we already talked about. And again, for those people who might be traveling to Africa, especially in those areas like Ghana, Kenya, Malawi, this is where they've actually piloted the studies from. It's important to know that this, if you're spending a good amount of time there, these vaccines are available for your children so that you can not only have to, think about what happens after you get malaria. This is actually a way to prevent it.
So, I guess the big question now is, how easily will this vaccine be able to be distributed in some of these countries, especially when you consider the fact that, distribution chains there are already strained because of the pandemic, but even before that?
That's an excellent question. And so this was initially a pilot study done in Kenya, Ghana, and Malawi. And so far, since 2019, they've already distributed 2.3 million doses to children. And so certainly the distribution is out there. Of course, with more funding, it's going to be more widespread. What they found, though, is that it is a feasible vaccine to generate or create. And, it's cost effective because you're also preventing death. So I think that, with time, it certainly will be more widespread in those moderate to high risk areas of malaria transmission.
How will this potentially affect malaria transmission in adults? Is this a vaccine that adults will be able to use at all?
That's a great question. I think more studies obviously need to be done on how long you actually, generate these antibodies for and how long it's, it lasts. But that being said, children are the ones who get the most sick from malaria, and those are the ones who honestly have death from this disease. And so I think, targeting children is a great place to start, with the hopes that, with adults, we'll also, now that we're on this trend, this is the first vaccine against a parasite that we'll be able to create more and more and more with time to come.
Wow, it's pretty incredible to think kind of just, what this really means, especially for the developing countries in Africa. Certainly hope that as many children as possible can get that shot so that they have a much better fighting chance against the deadly malaria.
Absolutely. And the other thing is it has a good safety profile. So that's the other point. It's a safe vaccine to get. It's 4 doses starting at 5 months of age. So babies are getting this vaccine because they have found that it's not only safe, but also effective.
Incredible. Well, thanks for informing us about this. It certainly is interesting. Thank you so much. You have a great morning.
You too. Thank you so much for having me.